Dipeptidyl Peptidase-4 inhibitors, also known as DPP-4 inhibitors, are a class of oral anti-diabetic drugs that work by enhancing the body's natural incretin hormones, which are involved in glucose homeostasis. DPP-4 inhibitors enhance postprandial insulin release and decrease glucagon levels, leading to better glycemic control. They are primarily used in the treatment of type 2 diabetes mellitus. In this video, we will talk about some clinical pearls regarding DPP-4 inhibitors. So let's get started. Pearl number 1. Renal dose adjustment. Most DPP-4 inhibitors, except Linagliptin, require dose adjustment in renal impairment. Sitagliptin, Saxagliptin, and Alogliptin are excreted renally, so lower doses should be prescribed in patients with reduced kidney function. Linagliptin is preferred in patients with renal impairment, as it does not require dose adjustments, and it is primarily metabolized hepatically, unlike the other DPP-4 inhibitors. Pearl number 2. Low risk of hypoglycemia. When used as monotherapy, or in combination with metformin, DPP-4 inhibitors carry a low risk of hypoglycemia, making them a good option for elderly patients or those at high risk of hypoglycemia. However, the hypoglycemia risk increases when combined with sulfonylureas or insulin. Pearl number 3. Cardiac considerations. Saxagliptin and Alogliptin may be associated with an increased risk of heart failure hospitalization, so caution is advised in patients with a history of heart failure or significant cardiac dysfunction. Linagliptin and Sitagliptin are generally considered safer from a cardiovascular standpoint based on available data. Pearl number 4. Pancreatitis risk. There have been rare cases of pancreatitis reported with DPP-4 inhibitor use. Patients should be counseled to report any signs of severe abdominal pain. Discontinuation may be warranted if pancreatitis is suspected. Pearl number 5. Combination therapy. DPP-4 inhibitors are frequently combined with other oral agents, such as metformin, thiazolidinediones, and SGLT2 inhibitor drugs. The combination with metformin particularly shows good efficacy without significant weight gain or hypoglycemia. However, triple therapy regimens should be monitored closely for hypoglycemia and other adverse effects. Pearl number 6. Weight neutrality. Unlike sulfonylureas and insulin, DPP-4 inhibitors are weight neutral, making them favorable for overweight or obese patients with type 2 diabetes. DPP-4 inhibitors are weight neutral due to the limited increase in GLP-1 activity. The incretin hormone GLP-1 has little effect on insulin secretion by pancreatic beta cells, in the absence of elevated blood glucose derived from gut absorption. In summary, DPP-4 inhibitors are useful and well-tolerated medications for the management of type 2 diabetes mellitus, particularly in patients needing oral therapy with minimal risk of hypoglycemia. Careful consideration of renal function, drug interactions, and the potential risk of heart failure or pancreatitis is crucial when prescribing these medications. So that's all for today. Thanks for watching. If you found this video helpful, make sure to give it a thumbs up and hit that subscribe button for more content like this. Leave your thoughts or questions in the comments below, and I'll see you in the next video. Thank you.